Right. Good afternoon. We have Christy Boudreaux with us today on Reality Check. I've been so excited about this moment and talking to you about having you on the podcast, and I'm so excited that we made it happen.
Thank you. I'm so excited to be here.
Yeah. So if you could just start, Christy, I know you and I know what you do on a daily basis to make the world better for our patients at EPIC. But I'd like you to introduce yourself to our listening audience and tell us a little bit about the history of Patio Drugs, where you work, and how it came to be.
Okay. So, I'm Christy Boudreaux. I'm a registered nurse. I've been a registered nurse for 30 years. For I guess the last 15 or 20 years, I've been a mental health nurse. I work for an independent local pharmacy, Patio Drugs, that's been in business 65 plus years now. I don't want to lose track. Part of what we do is we have injection clinics to administer long-acting antipsychotic injections that are ordered by the different providers in the area. They've become a need of maybe 15 years ago. We were approached about this because we had done a few other specialty injections and just that there was a need in the community. And so that's how it started, with just a few patients and now quite a few where I manage them, do the injections. I have a couple other pharmacists that do the injections with me. And I just work really hard to try to help them be compliant and get their treatment so they can live better lives.
Yeah, and I'm going to piggyback on what you just said about working really hard to help people be compliant. And I am going to throw accolades your way because you go above and beyond. Really, you do, to help people be compliant. And Christy has been a nurse for our patients for the entirety, I think, of the 10 years that EPIC has been around, if not the entirety, almost the entirety. And I remember meeting you at an injection clinic at the church around the corner from the clinic, which the name I'm forgetting.
Yes, First Grace United
Yes,
Methodist.
First Grace, who does a lot of community facing work and providing services and food and long acting injections for community members in need. And you were doing an injection clinic there. And I think we took some of our patients by there to get their injections. And I think what struck me is, first, when I met you and interacted with the clinic at First Grace, was just the calm way in which you approach the patients, the beautiful bedside manner you have when with them, and the rapport that you form. And getting a long-acting injection as a young person with a newly diagnosed, in our situation, psychotic disorder, can be a terrifying thing. And no young person really wants to be going to do this once a month. But somehow, in your own way, you help people to feel comfortable. And they show up because they have this relationship with you and this comfort level with you. They show up at First Grace. They show up at the pharmacy. They show up. And what we know from data is that the more adherent young people are, the better prognostically they're going to do in terms of their recovery from psychosis. And so that is all so important. And the other thing I want to highlight is that you work for an independent pharmacy. And I really think pharmacies like Patio Drugs are at the heart and center of the medication management for coordinated specialty care clinics. You all put the human component into the care that our patients get when they leave our doors, right? We can provide the psychiatry appointments, the therapy appointments, but in order for those to continue, they need to be able to stay adherent to their meds, and you all do that. So tell me a little bit about practicing at Patio and how what that experience is like for you.
So, I mean, it's not just me. I feel like we have a really great team in
You do.
place. some of our pharmacy techs have gone through mental health training, is it mental health CP? What?
Or
You
mental
know,
health first aid?
thank you. Mental health first aid training. I was at a loss for a second of the name, just to help them have a better understanding. And so I think that makes them just better able to talk to patients as they call in and work with them to get them, medication. We do the oral meds as well, and they do packaging and everything. What I like about it that I think we're blessed that we have is that, like you said, being an independent, we're able to focus on each patient individually and what they need and what would work better for each. And I've just watched through the years, I think they do a dynamic job with that. We have our little satellite clinic so that we can try to cover, patients who might live or work in a different area and find something that's more convenient. And that's something that I work with the patients, trying to find the best location for them. And sometimes that changes monthly. Might be going to stay with a family member or working a certain day, but I feel like the more flexibility that I can have and give to the patients, the better chance that they will be compliant with getting their injections. And then I call them a lot when they don't.
Right. Right. Yes. You work with a dynamic team who makes all of this happen. And I think the flexibility is what I think I found as a provider, and being at EPIC-NOLA for 10 years, the flexibility that Patio has allows us to work with you and our patients to work with you, right? Because we're working with young people right, whose lives are dynamic and whose diagnoses are dynamic. And in order to provide really quality care, I think there is a necessary level of flexibility. You gave a great example of someone going to visit a family member, for a time, and they need to have their medication pickup switched. You work with them. You all do a home delivery service, which for many of our families is, an essential part of their care. Getting back and forth to the pharmacy for the multiple medications that some people are on is an onerous task. When you, in some instances, have parents that are unwell or parents that are aging, this helps to facilitate and ensure that people are able to adhere to their medication regimen. I'm curious, from your perspective, what are some of the barriers that you see existing to care for young people with a mental illness and in our?
Of course, I do feel it as long as I've been in this field that I do feel it's improving drastically. But of course, there is still, the stigma that they feel. They're embarrassed. When you're young, you want to be like all your friends, and feeling like you're different in any way, I think for some of them is a challenge, and sometimes that may affect compliance. I tried at first appointment with somebody specifically, I really try my best to break down any stigma and just discuss how if you had high blood pressure, you'd have to take that medicine. And it's a little spiel I always try to give them. If you have diabetes, you have to take your diabetic medicine. This is just, a chemical that needs to be regulated. And that's why now we're lucky to have these medications. And if you, do your best to stick with it and discuss anything, side effects with your provider and that kind of thing, then hopefully it helps them feel better about it and realizing that they're not different. It's just medication to help them feel better. So that would be a big barrier. And then just sometimes I see with some hospital discharges I get where they might discharge a new patient from a hospital. And even that, again, I feel like has improved. I'm not tearing the hospital staff. But sometimes they might give one refill and then say follow up with the provider. And in some cases, it might take a little while to get that appointment. And then they might not have a refill after that. But I'm finding more and more, but I've been expressing that concern. So I'm finding more and more they're sending them home with at least, a couple just to give them a chance to get on board with their provider outpatient. So, I mean, those are the two of the biggest barriers that I can think of.
Yeah. As you know, because you engage with us at the community level, we're, working hard with Calm to bust stigma and to reduce it in our community. I think we have come a long way. And I think we still have a very, very long way to go. And as I've talked to other guests about, and I talk to people in the community about, right, stigma exists at all levels, right? You identified the way in which, right, an individual is embarrassed to have this diagnosis. And that embarrassment, that self-stigma, is exacerbated by community stigma and inaccurate notions, inaccurate perceptions about people with mental illness being dangerous, being bad, being their fault. And we as a community, it's essential that we as a community work together to continue to battle that stigma so that young people can get to you and get to other providers to get these medications that we know can help people function and recover.
Absolutely.
Yeah. I know we talked about you have these satellite pharmacies, you have these injection clinics, you deliver. Can you tell our listeners what the range of your services?
Sure. So it's not so much satellite pharmacies as much as it's satellite injection clinics.
My
So
mistake.
oh yeah, no. So we cover, I guess, delivery wise and medication wise, we have, we do packaging, which is, like individual packaging for patients to make it easier to manage their medication. Some patients like that. So they might get a month at a glance of all their medicine, or some patients do the little weekly packets. And so we do deliver that. We deliver in a 50-mile radius. We do injections. We can deliver injections to providers, and then we also have the injection clinics here, and then in our satellite clinics, which is like the Metairie area, the New Orleans area, Slidell to cover the North Shore, and then Gretna to cover on the West Bank. And so I do all the scheduling and anybody that works with me directly, because I don't like to just go by the patient's address. I like to look and talk to them and see what would work better. So we do, like I said, try to be flexible with that. And then the delivery, like you'd mentioned, we do deliver. It's like a 50-mile radius that we deliver. Something else we do, I think that makes us a little unique, is medical bills. Some of the insurance plans will only cover these injections under their medical benefit, where not all pharmacies can medical bill, because that's generally something that's done under the hospital, or maybe in the doctor's offices as well. So we can do that. We have contracts with some of the insurances to do the medical bill. So.
Right. And I'm thank you for explaining that. I think it's so important for listeners to know that these services are available. You don't have to just live in New Orleans or the greater New Orleans area. Within 50 miles, they can get served by Patio. And I think as we expand EPIC, as we move into the South Central and to the Acadiana regions, right, we're going to continue to work with you to push sort of to the limits of these this 50-mile radius. And then, our goal will be to try and find other small independent clinics who are in these outer regions, because our experience with y'all has been so wonderful. And I really do think it matters a lot. I think when I check in with my patients about whether they've gotten their injection or not, they'll say, "Oh, well, Miss Christy's going to call me. She'll tell me when it's my time to come in." Right? They know to expect that call. But how wonderful, one, as a young person, to know that you can rely on this adult human provider to call you and remind you. And then not only do you call, but you follow up if they don't show, right? You follow up with them, but then you follow up with us at the clinic and you let us know if someone doesn't show. And it's all right in the interest of helping people stay well and adhere to this medication plan that we know will improve their functioning.
I do. I do definitely follow up. Sometimes I think I'm a pain, but I've had some patients that might be just having a rough time, they don't want to come out and get it, they'll 9 out of 10 times they'll tell me, thank you for keeping me back in, because that's what made me finally,
Yes.
I feel like I'm being a pain, but I think most of them appreciate. So thanks. Thank you for telling me that too. I like to hear
Yeah,
that.
true story. And I think the other thing is you've been at Patio Drugs for, you said how long now?
Forever.
For a long time. I've always done of course I was in the hospital probably like my first 10 or years or so, 15 years of nursing. So at least 15, 20 years I've been in some capacity.
Well, so I highlight that because I do think the mental health field, because of the acuity of illness and how hard it can be to manage, there's a lot of turnover. And I think when you can get people such as yourself who have been, and your team, who have been in the field and in similar positions for a period of time, right, that also helps to enhance trust and build rapport. And so my follow-up to that point is a question. And I'm curious, what has kept you in this for 30 years in nursing, but in 15 years of working in mental health nursing?
Well, I'm going to tell you, when I was in nursing school a very long time ago and I did my rotations, the two areas that I loved the most was mental health and pediatrics. When I got out of nursing school, I went into pediatrics, and that's what I've done for my first 15 years of nursing. The last 15 years, this kind of happened that I got into mental health because there was a need. They approached us, but I love it better than any area of nursing I've ever done. I find it so rewarding to see patients that might come in for their first injection, and I'm seeing them at their worst, sometimes the worst point in their life. And then to see as their injections start working and they continue with their treatment with y'all, that they start, all of a sudden getting back in school, getting a job. That to me is just, and it's amazing to me. And it inspires me. They inspire me every day. So that's what's kept me at it. I love it. It's a love now. And I'm just, very important.
Yeah, no, I totally hear you on that. And it's similar on the clinic side. I think that it is the beauty and the privilege of being able to be with someone across their journey, right? And to go from, yes, I agree, probably one of the hardest, most difficult moments in a young person's life to, this moment where we can see them thrive and succeed and engage in the world. Like that's a privilege and so super inspiring.
Yes, it really is.
Yeah. And we've had the shared privilege of, treating many of the same people for almost a decade now, which is,
Yes.
yeah.
Amazing. It's been amazing.
Yes. And we see people grow up right? Because some people are coming in seeking care at a young age, right? We're getting people in high school, which they're getting to care soon. And that's what we want because we know the longer the duration of untreated psychosis, the harder the recovery and the worse the prognostic outcome. So we see them in high school and they move up and through high school, graduate and out into the world. And that's super cool.
It is. It really is.
Yeah. I'm curious what you would say, just from a nursing perspective. You've found this passion, you've found mental health as, right, your love within the field. What would you say to someone who's just entering the healthcare field as an MOA or moving into nursing school? What would be your pitch for pursuing mental health or psychiatric nursing?
Well, I would share my story and how rewarding it is. I would remind them something that I feel like I've learned is self-care, that it's very important to take care of yourself because it's the analogy of the oxygen mask in the plane. You put your own oxygen mask on first before you help anybody else with you. And so I think to be more beneficial in this field, because it can be very draining and, it's very important to make sure you're always taking care of yourself first as well, to stay strong to do it.
Mm-hmm. Yeah. Yeah. No, I think I appreciate both of those things. And I do think when you do both of those things, when you listen to your heart and you take care of yourself, I think you can really make an impact, in the lives of young people and their families. And I would be negligent if I didn't bring that up. You provide these long acting injectables and these medications to young people, but I think your collaboration with their family members, their caretakers, is essential too. And as we both know, and as many of our listeners know, this is just a scary, disorienting, time in a young person's life when they're first diagnosed with a psychotic disorder. And to be able to have a provider, a nurse, pharmacy that you can talk to and you can ask questions. And as a family member, that is huge. And I am circling back to the beginning of the conversation. You talked about the psychoeducation that you provide patients, trying to help them to understand what these medications are doing, what some of the side effects might be. That might seem obvious, but it doesn't happen all the time. And it doesn't happen everywhere and in all pharmacies. And it is so essential because these meds, they're big meds with, heavy side effect profiles, and to be able to help young people understand what they can do to help them and what some of the things are that they need to look out for in terms of side effects. I think that's empowering. And anyone who's brave enough to show up for a long-acting injection deserves, deserves that treatment and that source of empowerment.
Great.
So as we move ahead and we move forward in this work in the next, decade, what do you think are some of the priorities for you in the world of pharmacy and nursing? And then I'm going to ask you think what we should have our eyes on in the world of coordinated specialty care.
Okay. I think obviously what y'all are already doing to continue to go out there and reach everyone you can to reduce the stigma, I think is vital. Hopefully there will be a day where there is no stigma out there.
Right.
So I think that is important. Another thing, this is not for me as a provider, but one thing I'm seeing more is the testing that's being done on what works, what will work on some patient based on their makeup, chemical makeup, and what would work better for another patient. And I think y'all might be touching upon some of that because I've had the conversations, patients with fast metabolizers, that kind of thing. And I think that's very important. I think that's a breakthrough, hopefully, in treating mental health.
Absolutely, because I think some of the hardest work is done up front when you're first getting on these meds, right? Most of these young people are medication naive. They're having a hard time tolerating. And if we can mitigate the trial and error and get someone on something that agrees with their body, their metabolism, their makeup at the outset, it makes things easier.
Absolutely.
Yeah. And I think to that point, right, knowing, and this is such an important part of the care that we give and the work we need to do, knowing about family history, having family members be honest about their history, reducing stigma within the family, and speaking openly about medication. And if you have a family member, with a chronic and severe mental illness, what medication has worked for them that can help, right, in treatment in the early phase. Yeah. Yeah. So the road is long, but I know our commitment is strong. And so thank you so much, Christy, for coming on to Reality Check. Thank you for the work you do in New Orleans and beyond. And I look forward to seeing you at In My Mind in November, if not sooner.
Absolutely. Yes. Thank you so much for having me. I'm honored. I really appreciate it.
Yeah. Thank you so much. Take good care.
Take care. Bye-bye.
Bye-bye.